We'll just go through what we call our MyoSmile program.
Okay.
It's also called Grow Your Kids Healthy. So rather than just having braces to move the teeth, what we try to do is grow the face and grow the dental arches so that there's room for all the permanent teeth. And so years ago, I did heavy duty silver braces, and I did, even impacted teeth and pulled those down. I did some really advanced cases. So what I have noticed is, and what I have found through 46 years in dentistry, and what's noted in the dental history now for almost 200 years, the teeth go and are placed where the lips, cheeks, and tongue push or pull them. So myo means muscle, and form always follows function. So if a kid can't breathe through the nose and the mouth's always open, then the lips and cheeks are not touching the teeth like they should be. Or if they've got a tongue thrust, or if they're tongue-tied, the tongue doesn't act as the expander to the upper arch like it should. The tongue should be the expander, and the tongue should be the retainer. So if the tongue doesn't function in the 3,000 times a day we swallow, or the 30,000 times a day we breathe, that's really what puts the teeth where they are. So crowded teeth has nothing to do with teeth. Has more to do with the 3,000 times a day, 500 grams of force of the tongue is pushing on the teeth, or 100 grams or 300 grams of the lips or the cheeks pulling on the teeth. And it takes less than 2 grams to move the front teeth and less than 5 grams to move the back teeth. So the tongue is, 100 times stronger than 250 times stronger than it takes to move the front teeth, and 100 times stronger than it takes to move the back teeth. So the teeth go where the lips, cheeks, and tongue push or pull them, depending on if the mouth is closed, because we're supposed to breathe through our nose. So our breathing makes our whole biochemistry. So, we can eat and drink to make us alkaline or, acidic or whatever, but really and truly, it's the breathing mechanism that the carbon dioxide and oxygen exchange creates our buffer. Carbon dioxide is actually the buffer in our body that makes us either more alkaline when we're all too acidic. Everybody knows we're too acidic because of all the toxins in the environment. So every toxin, whether it's sprayed in our air or put in our water or put in our food or put in our medicine, or if it's EMF, or if it's stress or anxiety or physical trauma, every toxin makes you hyperventilate. Well, for the 200 years of recorded medical history, we've breathed about a gallon a minute, 3 to 4 liters a minute. But now the hospitals have set all the oxygen machines at 2 or 3 or 4 gallons a minute. So from 3 to 4 liters a minute of optimal breathing, that's always been in medicine. Now they've changed that, but it's not optimal. It's typical, but it's not optimal. It's what everybody breathes. So we're breathing for 2 or 3 or 4 people, but that's like putting your foot on the brake of your car and revving the gas. That's not good gas mileage. Well, we're not getting good breathing mileage out of our bodies because we're always in that fight or flight. And it's like when I was a teenager, I've had sleep apnea, or had sleep apnea most of my life. And when I was a teenager and would go scuba diving, I would use more tanks of air underneath the ocean than even the big burly men, because I was hyperventilating. See? So I have the different bones in my mouth. I have lots of different signs inside my mouth that show that hyperventilation. So what we do with the kids, and even if I never get to do their teeth, if we can teach them to reset their breathing mechanism so they get optimal breathing, then their biochemistry goes optimal, because carbon dioxide dissolved in our blood is carbonic acid. So that, and there's 5 different stages of carbon dioxide in our body, but that is our buffering system. But we just don't use it anymore because we're more sedentary, we're more toxic, and nobody talks about it anymore. We just don't talk about this kind of thing. So what I do is I use either an expander like appliance, depending on the age of the patient, an expander type appliance, and about 85% of the children start with that expansion now. When I started this, the MyoSmile program about 15 years ago, probably 10 to 15% of the kids had to have an expander first, and mostly they just used these more silicone type softer appliances. And now that has flip-flopped over the last 15 years. About 85% of the kids start with this expander type hard appliance to increase the size of the arches right away. Then we retrain the poor old habits with the silicone type appliances. Some of the silicone appliances are different, and some have a core that's a stronger, there's a little bit of expansion in one of those harder ones like that. So typically now, about 85% of the kids need the expander. That's for 6 months, and that increases the size of the jaws so that there's room for the permanent teeth. If I can get the kids in their complete baby teeth, called primary dentition, then we can get the jaws growing so there's room for the permanent teeth to come in. But most of the time, even by 6, they've already got some permanent teeth coming in, so they're in that transitional. But we still need to get the arches big enough for the teeth to come in. So what I tell the kids is, if you go get braces, you lay in the chair and the people do all the work. But with the MyoSmile program, we're going to help you know what to give you for appliances, but basically they have to do all the work. And moms and dads have to help be cheerleaders, and we'll help be cheerleaders. But it's really their responsibility, because even at 5 or 6 or 7, and there's no age limit. I've done this on 65-year-olds, so there's no age limit. The bones in the skull are never set. Form follows function no matter how old you are. But I tell people, if you want to have better academic scores, or if you want to be a better athlete, or a better artist, better dancing, better music, better hand-eye coordination, if you want to have better mood and attitude, you know, I have had a clinically diagnosed child with depression at 6 years old. So, because it's all biochemistry, everything in our body is biochemistry. If you want to be sick less, allergies, asthma, eczema, ADD, ADHD, which I had at, when I was a kid, but nobody knew what it was. But the telltale sign for that is I wanted the tags cut out of my clothes at 6 years old. Back when Tommy Hilfiger tags were on the inside of clothes, my mom bought me an outfit, and she said, "Oh, I'm not cutting that tag out. That's a Tommy Hilfiger." I said, "I don't care what it is. If you want me to wear this outfit, you better cut the tags out." So that's one of the first signs of ADD, ADHD. And she said, "I was born 2 weeks early and been in a hurry ever since." And that's really true. But the kids will usually resonate with one of those things. They want to, have better sleep even. Kids don't sleep well. And so grinding teeth is one of the first signs that parents notice of the airway issues. We all have these airway issues because our environment is just so toxic. So, and we don't work outside, like we used to. We don't get out and sweat. You don't get out and play. That's right, run and play. And we don't have muscle activity. So our muscle activity is what creates the carbon dioxide. So one of the things, especially in the last 5 or 6 years, carbon dioxide's gotten a bad rap. It is not a poison. We breathe because we need to regulate our carbon dioxide. The primitive brain in the medulla oblongata will help us to breathe no matter what else is going on. And it's the strongest reflex in the body to breathe. But we breathe based on our carbon dioxide level, not our oxygen level. So back when the redwood forest grew and the trees were so big, the atmospheric carbon dioxide was 8%. It has been into the 10s and 20s percent. But it's 0.04% now, 200 times less than when the redwood forest grew. So in utero, a baby is surrounded by 8.5% carbon dioxide. That's why we swaddle babies to suppress their breathing when they come out, so that their biochemistry stays that optimal. Okay, they come out and they breathe in all this carbon dioxide poor air, which is opposite of what we've been told. But if we had 8% carbon dioxide, a big breath in would be optimal for our pH, but it's opposite. So we're having to work against our environment. That's why our kids have such issues, and crowded teeth is one of the things that is most notable as far as being able to tell our biochemistry's off, is crowded teeth. So we typically start with an expander for 6 months. They're limited to 6 months. They can get up to 8 millimeters of expansion, And then we, hey, you can just set it in the window. You need a signature? No? Okay, great. Thank you. I'll just start it. So basically, we typically start with expanders 85% of the time. And that's a 6-month thing that the kids wear 22 hours a day in order to grow the jaws really quick, especially as those new teeth are coming in, because a baby tooth is one size, but the permanent tooth is always time and a half bigger. So that's why by 6 they should have spaces between their teeth. Should look like picket fences with spaces. So those spaces are actually healthy by the time they're 6, because then the new tooth comes in. Each new tooth is bigger, so it takes up that space. So that's why if we can get them before those new teeth come in, that's the ideal time. But sometime during that transition of when the front teeth are coming in is the biggest growth naturally of the jaws anyway. So if we can help accelerate that growth of the jaw, we've got room for the teeth, and then you don't have to be pulling and pushing on the teeth themselves, because the form actually becomes optimal when the function is optimal. So when they're breathing right, they're swallowing right, and they're not having, a lot of kids will suck their spit before they swallow now. And I think that may be a sign of dehydration. And so we've been taught not to use good salt. We've been taught, well, the not good salt is one of the things that helps with hydration. Also, our sense of thirst has turned into a sense of hunger. So many times we eat when we're really thirsty, we perceive it as hunger. It's really thirst. So a little bit of salt and sipping throughout the day will help that. So, but I see kids have even moderate to severe crowding. Even in the last 5 years, the crowding has gotten much more severe. I have more kids now that we classify as severe crowding. And part of the paperwork that I do in the workup is I do a written assessment of where they stand as far as the amount of crowding and the oral things that I find in the mouth. I also outline treatment for what I think would be optimal, but depending on their age and their expectations for when they need to wear appliances. The expanders are 22 hours a day. Take them out to eat and clean, but basically 22 hours a day, but that's only for 6 months. So then the softer silicone appliances typically are worn 2 to 4 hours a day to train the brain while it's awake, and then they wear it all night while they're asleep. So that just trains the muscles and the swallow pattern and keeps the tongue up where it's supposed to be. In the last, I have forgotten what year it was, but since 2000, there's a law that says all of our grains, oats, all of that has to be sprayed with folic acid. Well, about 40% of the population can't tolerate folic acid, and that's one of the reasons that so many kids are tongue-tied. So we need folate, but not folic acid. So I see a huge increase in tongue-tie. So if the tongue is tied, it can't do its job by expanding the upper arch. So that's a big issue, this folic acid. And I just found out recently that it was passed into law, maybe 2006 or so, I forget, but it should be folate, not folic acid. So that's an issue. I also outlined the time I think that the child will need to do, phase 1, maybe phase 2. Sometimes phase 1 is all they need. And then compliance goals. We outline what they need to do, what they need to expect to wear the appliances. And so we start with a write-up. After I do my workup, we start with a write-up of, your comments and your goals. If I'd like my child to look like this or talk like this or whatever. And then what I evaluate, the objective that I see. I write up a written assessment and a plan. And then, y'all can choose some, all, or none of what my evaluation is. And so then we come up with a written time period. In the first month, we'd like you to achieve these things. The second month, so we give you milestones to see how compliance is going. And so we can have more visits if we need to, or I ask that the kids really like to help take pictures of their own mouth every week and text them. And then if they text me, hey, I'm doing good, or I've got questions, that communication keeps you from driving so much, and yet keeps the kids interested and keeps the communication going, which helps them with, some positive reinforcement. I also, hopefully this month, will be done with an app. I've added the expanders to a little, looks like a little game on the phone. They push a little smiley face when they put their appliance in, and push a little smiley face when they put some tape on. Taping is very important. You've probably heard, a lot of people have heard about taping at night. That keeps the mouth closed to be sure we breathe through the nose, so that makes the biochemistry go optimal all night long. I tape my mouth every night unless I fall asleep with the tape in my hand, and it's a micro pore tape. Sometimes I have a little roll to show you. Yeah, got a little roll. 3M makes one called micro pore. It's kind of a paper-like tape. It's a real flexible. So if you put this whole roll of tape over your mouth, you can still breathe through it. So you don't have to worry about anybody suffocating. And I encourage the parents. There's the medulla oblongata reset, breathing center reset that I did 12 or 14 years ago to treat my sleep apnea. I encourage parents and children all to take that. And so we teach the taping. We teach some other lifestyle things that help with the breathing, because breathing is what sets your biochemistry. Biochemistry is what makes your growth hormones. It regulates your immune system, upregulates your immune system, downregulates chronic inflammation, autoimmune disease, anything bad. Carbon dioxide helps get rid of. More carbon dioxide helps increase all those good things: cell metabolism, immune function, neurotransmitters, that tell us when we're really hungry or really sleepy, or helps us to be happy and settled. More carbon dioxide helps all the good things. So taping is really good. It's not scary. So we introduce the kids in a really easy kind of way for the things that may seem a little, parents look and go, oh, they got a tape, I don't know, I don't like that. So we encourage the parents to do it too, so they can see what it's like. And the Buteyko breathing, classical Buteyko method, is taught free for everybody all around the world. It's online, so everybody can take it. Everybody can see. The parents can reset their own breathing, and I encourage the parents to also treat their breathing. Anybody who snores has got sleep apnea. A child that you can hear their breathing is considered disordered breathing. We should never be able to hear breathing. And one of the main things that Professor Buteyko, a Russian academician, very, very highly ranked academician, studied hundreds of thousands of people, did a lot of research that just reinforced the science we already knew, the Bohr law, the things we already knew about breathing. He just reinforced and made an algorithm that is the number one most accurate predictor of health in the future, and it's called control pause. And on my website I have the test. You can take the breathing test and see what your control pause is. It's more accurate to predict health and to give you an evaluation of your health now than any other vital sign, including heart rate variability. And so that's on my website. You can test your own breathing, and then you can sign up for the free breathing classes, and that will, when you do that with your child, then that reinforces them to want to do this, and then everybody begins to sleep better, rest better, feel better, better mood and attitude, better growth hormones, less sickness, less autoimmune issues, less sinus allergy. I just spoke this week at my grandchild's school, and out of 17 kids, probably 3 of them I could just see their mouth was just totally open all the time. And then, the first thing I taught them was the nose clearing exercise, because you can think better when your head's clear and you got to get all that snot out. There, 2 or 3 of them were, like this anyway. And so that's the first thing I taught them in kindergarten, was the nose clearing exercise. To clear the nose, we have to nose breathe. To be happy, healthy, settled human beings, we're supposed to breathe through our nose all the time. Not in through the nose and out through the mouth. It's only nose breathing. So that's the main thing that I want to encourage people to do, is to investigate how to be the best you can be. That's what I want for our kids. Does that make sense? Yes. Good. Well, thank you for coming for the demo today. All right. I hope that was recording.